Benefits Administration Analyst Deborah Brown. Today we have representatives from Blue Cross Blue Shield, Delta Dental, DenCap Dental, and Heritage Vision. They're going to talk to us about their plans and answer your questions. We'll ask that you put your questions in the chat box, um, or you can contact the benefits team directly at benefits@waynecountym.gov, or you can call us at 313-224-5157. Um, those folks that put their questions in the chat box, we will answer those questions following each session. Open enrollment for the 2026 plan year will occur November 3rd through November 24th via Oracle self-service, and there will also be on-site meetings with American Fidelity representatives. Information on how to enroll and how to schedule appointments with American Fidelity representatives will be emailed to you later. And Sharice, we will get started with you.
Well, good morning, everybody. Good morning to everyone at Wayne County. My name is Sharice Hogan, and I'll be presenting the Blue Cross Blue Shield of Michigan and Blue Care Network of Michigan, PPO and HMO information. For the actual session, I'll go off camera, but I wanted to say hello and good morning to you all. And then I'm going to share my screen, and if I could get a thumbs up from someone, or someone comes off mute to let me know that you can see the material, I will immediately get started.
Yeah, we see you.
Awesome. Thank you so much. So today we will be discussing the 2025 open enrollment for Wayne County employees. We will be covering your 2026 plan options. We'll go over the member account information, and then we'll talk about some of the additional benefits and programs that are offered to you as Blue Cross cardholders. Advanced planning can help you feel more confident about your healthcare decisions, and open enrollment is the ideal time to review your current plan usage and to make the best decisions for you and your family. We suggest you review your overall cost. This will allow you to take a peek at the details for your medical and prescription coverages. For those that are existing members, you can do this by logging into your online member account to check the claim summaries that you have for your family, including those with prescription as well. And if you do not have current coverage, take a peek at the benefit documents offered and available to you from Wayne County to do a comparison to make the decision. We then ask that you assess how much you have contributed if you have an HSA. This will help you determine if you need to increase your annual contribution or make any changes for 2026. Next, identify that your providers are in network. With Blue Cross networks of coverage and providers, it is very vast. So it's likely that your physician is going to be in our directory, but it's unlikely that you can find that unless you go directly on our website, or if you're an existing member, that you log on to your member account to find a doctor and ensure that your doctor is going to be in the system for you for 2026. Again, if you're a returning member, you can go do this online, go to find care under the Doctors and Hospitals tab. Select the plan you are interested in, and then you can search the providers that are in that plan's network. If you are a new member, since your online member account will not be accessible until after your effective date, you can go directly to your doctor and ask, or you can do a general search directly on the bcbsm.com website. Last but not least, planning is important. As you make your decision, think about possible surgeries, new conditions that may require additional medical care, or that for your family as well, for who will be joining your health plan, or also those who potentially may be removed from your health plan. All of these things collectively help you make a decision and meet your own bottom line. So to best choose the plan that works for you, we're going to do a quick review of some components that are inclusive of all of our plans. One, premium. Premium is something that you will get directly from your employer, but it's something to consider because the difference in premium can cause you to make a different decision. And that is part of your payroll contribution. And then you have out-of-pocket costs. These are the portion of healthcare costs that you are responsible for, and that are out of pocket, like deductibles, copays, and co-insurances. And then when you think about a deductible, you think about this being a set dollar amount apart from your premiums. These are the amounts that you pay for healthcare services before your actual health plan begins to pay. And we'll look at some of these numbers when we show your plan options. Copays are the type of out-of-pocket costs with a set dollar amount you pay for healthcare services. This includes prescriptions, and then you receive those, and then it's a fixed dollar. You would pay that directly to your provider or to the pharmacy. When you see coinsurance, this is a type of out-of-pocket cost that's usually expressed in percentage. When you see this percentage, you pay your deductible, and you might see that you owe a 20% or whatever percent amount. We pay the remaining amount for you, so you don't have to worry about that. But you can collect these particular numbers and see the balance of those numbers directly on your member app. And last but not least, you have the out-of-pocket maximum. This is the most you'll pay during a plan year for health services. All of these amounts that you contribute, your deductible, copays, and coinsurances, are part of this big bucket that we call an out-of-pocket maximum. And again, once you reach that, including the different amounts that you pay, you will no longer pay for services after that time. So this was going to go in a little bit into the plan options you have and maybe give you some reasons why you may want to select the PPO over the HMO. The PPO gives you the deepest provider network across Michigan and across the country to get care wherever you are. Some of the key features of the Blue Cross PPO is one, you do not have to be assigned to a primary care physician. We do encourage you to see your regular doctor on a normal preventive care basis. Referrals are not required for this particular plan. This is for in or out of network services. Although you're covered for out of network services, you will be paying a higher price for out of pocket costs. So you want to just potentially lean towards in network services, but again, it's not required. And this plan is also ideal for those who may travel a little more. So your PPO has providers that are going to be considered in network in Michigan. And then when you travel, go out of state, you will find that this is a flexibility for you. If you look to the right side of the screen, we already talked about the flexibility of the plan, but we also want to just point out that this plan is best for people, again, that have travel needs, children who may be out of state more permanently and still on your coverage, so it accommodates different geographic locations. And again, you don't have to be assigned to a primary care physician, so that flexibility is helpful. But again, we want you to make sure that you're seeing a regular doctor, seeing your specialist regularly, but that's only to make sure that you're getting the care you need, not, again, that is required on this particular plan. If you are choosing to select an HMO, HMOs provide cost savings with coordinated care, and it all starts with your primary care physician. So some of the key features of an HMO is that you have to be assigned to a primary care physician that is in network with the plan. If you need a referral to see a specialist, then your primary care physician will need to coordinate that. Out-of-network coverage is not a part of this plan unless it's an accidental injury or a medical emergency. So it's covered for that. And if for any reason you need to receive care, you need to make sure you're assigning yourself to the primary care physician of your choice. One very common error that we have is that if you do not actually assign yourself to a primary care physician, the system will assign one for you. But we want to make sure you're going to the doctor you want. You can change it at any time, or you can just choose to go to the one that we selected for you in the system if you choose. There are some exceptions to the rule for an HMO. If you're a female seeing an OBGYN, there is no referral required from your primary care physician for your OBGYN services. And that doctor does have to be in network. We'll cover treatment for accidental injuries no matter where you go. So your accident, of course, does not have to be in Michigan. We will make sure you're covered for emergency care, and then any follow-up needs that you may have if you're going to be traveling for a longer period of time, we will ensure that those are coordinated, but you have to contact your primary care physician. Also, no PCP referral is required if you're seeing a behavioral health provider, but the provider, again, has to be in network. This plan is ideal for those who live and work in Michigan. If you're looking for something with a lower premium, with just a little added care coordination by your primary care physician. And if you're conscious of staying in network, it forces you to stay in network because, again, out-of-network services are not covered. For PCP Focus, PCP Focus is a part of the HMO umbrella, and it's centered where you work, live, and play, with access to thousands of primary care physicians throughout Michigan. This plan, again, requires a primary care physician. It does require referrals. It still does not cover out-of-network services. But in addition to that, it's ideal for those who, again, live in a certain service county, and those counties are listed on the right side of the screen. But again, this is for those who are looking for lower premiums. You do prefer to have coordinated care with your primary care physician, and again, that you're conscious about staying in our network. But again, PCP Focus services 31 counties in Michigan, and that is the restriction around this particular plan. If you are a person who is taking advantage of an HSA, which is a health savings account with a qualified plan benefits, this does not change your access. You have the same doctors, same network discounts as you would have with a non-HSA, with a few additional perks. So I'm going to highlight a few of those perks here. The HSA deposits aren't taxed, or they're tax deductible. Another is that there are tax advantages to help you save for the future. And HSA funds can be used by you, your spouse, or your taxable dependent to pay for qualified medical expenses. If you are not aware of which expenses are qualified medical expenses, that list can be found on irs.gov. So now we're going to talk a little more specifically about your plan options, with each providing convenient, high quality care. So you see on the screen here that you have plan option 1, plan option 2, plan option 3, and plan option 4. Plan options 2 through 4, as you can see, are your Blue Care Network plans. Options 2 and 4 are those PCP Focus Blue Care Network plans. And then the final option 4 I want to share is the only one listed here that does not have an HSA qualified status. Here you show first on the line, here is your deductible. Each of them have the same deductible across the board, $1,700 per member, $3,400 per family. Your copays for the first 3 plans apply after deductibles, and we talked a little bit about what it means for a copay to apply after deductible in the earlier part of the presentation. However, option 4, because it has no HSA qualified status, you will see copays for office visits, specialist visits, urgent care, emergency room, and pharmacy being shared specifically within the plan documents. For the coinsurance, they're all 20%, and that is that amount that we mentioned after your deductible is met, then it'll apply that percentage coinsurance. Out-of-pocket max across the board is $2,300 per member, $4,600 per family. And I bring this up now because this is that bucket of money that after you pay this total amount maximum, then your health plan covers your expenses for the remainder of the year. And last, on the final line, the coverages before deductible for your plan options 1 is your preventive care and preventive RX. That should also apply to plan options 2 and 3. And then for plan option 4, as we stated before, the coverage before your deductible is any of your preventive care services, office visits, specialist visits, urgent care, emergency room visits, and pharmacy visits. So we understand how important prescription drugs are. And we want to make sure you understand and you're considering when making your plan decisions, how you can make informed choices. So first, we want you to understand your medications. To see which of your medications are included, you can find the full drug list for Blue Cross on our website at bcbsm.com/drug list. You want to make sure you talk to your doctor about new prescriptions or any requirements for specialty drugs if that's applicable to you. Also, when choosing and ordering your medications, you want to rely on your Blue Cross member account. And remember, it's very important that each of our members understand that generic drugs are just as safe and effective as brand name drugs. So that take that into consideration. It'll lower your cost, and it also gives you the same effectiveness as your brand name medications. And just skipping further to the bottom, think about using home delivery for maintenance drugs. And also, you can check the status of shipment of any mail order or refill drugs. I say this because you don't want any particular issues when it comes to the beginning of the year with your mailing statuses and your maintenance drugs if you're going to change plans. So you want to make sure you have that all situated before the beginning of the year. And then as you continue for the following year, you can re-up and reconnect for that prescription to be under the right plan for you. For new members, you should avoid delays to ensure continuous care by making sure you're fulfilling anything that you have under old plans prior to the beginning of the year so that you can, again, lose any issues with delays or you not being able to get, of course, your drugs to the proper locations for you for the new year. Next, we're going to talk a little bit about those additional benefits I mentioned earlier. Here, for additional benefits, these are designed to help your whole health needs and also just make sure we're providing robust coverage for you in 2026. So these just include some things that you may know that be aware of and potentially some that may be different for you or new for you. On the left-hand side, just want to point out virtual urgent care and virtual mental health care. This is great access for care for our members that need convenience and still need to ensure they're getting the care they need. 24-hour nurse line. This is one of my favorite programs that we offer at Blue Cross because it allows members to actually tap into a nurse 24/7. And this particular opportunity allows you to just kind of talk through any type of medical needs you might have. Sometimes you can avoid an urgent care visit or emergency room visit and just do some of the, take advantage of some of the tips they give you. And then you have behavioral health care here. These are just some of our many tools that we have available to our members who need care outside of their physician, their regular physician, and need to ensure that they're keeping their whole health and taking that into consideration for themselves and their families too. Condition management, Blue Cross Coordinated Care, is actually a program that's an outreach program. So if you're a member that has a chronic condition and you're seeing numerous providers or you were inpatient at the hospital and you're being discharged, we do have nurses and a staff of team that actually will reach out to you to help you coordinated care or maybe help you give you tips or give you direction for next steps. Then you have diabetes management. We'll share that in just a moment. And if you go to the very right side of the screen, you see here it says ahealthiermichigan.org or mybluedaily.com. These are articles and podcasts about a variety of behavioral health topics to improve your whole health. So please tap in and you will be able to get information to help your regular health needs and as well as your families. So our diabetes management program helps you monitor blood sugar levels, and develop healthier habits. This is through Teladoc and is offered as a program, a very easy to use program with personal support to stay on track with your care plan. If you look to the left, the program provides quite a few things. Smart devices that remove hassle, including an advanced blood glucose monitor. And then if you go down a little further, it also provides unlimited test strips and lancets. And it also adds support for people who are dealing with hypertension, weight challenges, and maybe some mental health challenges around that particular condition. Who has access? It's members with type 1 or type 2 diabetes. And it's very easy to enroll. So here you can see you can enroll by phone. The registration code can be provided by the county. And then also you can download the Teladoc app by way of the Apple Store or Google Play. Mental health for Blue Cross has become a very broad focus, and we want to make sure that you know that we understand that it's just as important as your physical health. So we wanted to build a website that provides guidance and resources to support your unique needs. Here, you can go to bcbsm.com/mental health, and you can visit that site for a variety of mental health and substance use disorder resources, including crisis assistance, tailored guides for different audiences based on that person's needs. And then we have a number of different readings that will help you along as well. Again, this website can be shared with your family members, friends, neighbors. And again, it's a resource for anyone that you need to support for your own support or for their own support. Also, if you're a Blue Cross member, this means that you have a Blue Cross card. There are numerous perks, like exclusive discounts through Blue 365, which is our health and well-being savings program. To access a full list of the different vendors, you can just go to your member account, select Blue 365 member discounts under programs and services, and it releases and provides to you all of the exclusive discounts on a variety of items, including apparel, fitness, vision, nutrition, travel, and much, much more. But in order to tap in, you will need to have a member account to see the full list of those opportunities. Last but not least, we're just going to go over the member account, just an overview. Your member ID cards actually have important information that you need to receive care. That's why we make sure you have this physical and virtual. To be honest with you, I have not seen a physical card and I have not had one in a very long time. And I have adult children and they haven't either, because I get my virtual card. If I change my plan, I just share it out with my 2 daughters. And then at that point, they have the full information at their fingertips as well for their healthcare needs. Your ID card has your subscriber name, which is shared amongst all your cards. So a different name or a different number is not on your family members' cards. It's one per family. And then it also has the customer service phone number on the back of the card. This will give you access to our team who will assist you with your questions. And then last but not least, when you receive your card, you want to confirm, one, that all the information is correct. You want to make sure you keep all your cards, whichever cards you have, that separate so that you can make sure you're presenting them when needed for different forms of care. Again, you want to download the app. And if needed, you want to share your virtual ID card with your providers through the app, because I just show it to my doctors, or you want to make sure you share it with your family as needed. Also, your member account allows you access to information and resources when and where you need it. This is inclusive of coverage and plan information, claims for you and your family, so you can just kind of cross-check when you've been billed by a provider and to make sure that that information is correct. I think that's very important. I do it quite often. Then if you go to the bottom, in order to release all of this information, there are 3 very easy ways to create your member account. You can go online at bcbsm.com/register. You can download the member app. Again, that could be found through the Apple Store or Google Play, and you can register there. Or you can simply text register to 222-764. You can do that today if you're an existing member and you do not have access to our member account. And then you can do that futuristically after your account is active with Blue Cross, which is 1/1/2026 if you're a new member. And just a couple more things. And the reason why we highlight this is because we know how important it is for members to see the provider they want to see or to get recommendations provided to providers that are in your area. So here, in order to choose an in-network provider, it's easy to find right on our website. If you are a current member, you would want to log on to your member account to get a more personalized experience with the Find Your Doctor tool. And if you're not a member currently, then you would want to go on a general search and you can easily find a doctor on our website at bcbsm.com/findcare. We talked about this a little, but just as a different breakdown and a different view of what you can see as a claim summary, so that you can easily monitor your claims and expenses for everyone on your plan. Why is this important? Again, this will help you make decisions for next year. As mentioned earlier, your open enrollment time is coming up, and we want to make sure you use this type of review to determine if you need to maintain the plan you currently have, increase your contributions on your HSAs, or maybe switch to a different plan that just may not be maybe a little better for you and your family based on your needs and your cost. So take advantage of this. If you're a current member, you can use this claim summary to look at total charges, what was covered, and how much you may owe. This is something that we wanted to call out this year. Confirming or updating your coordination of care benefits could help you streamline processing of your claims. I don't know about you. I've received the text or the email saying, hey, your doctor has submitted a claim for you, and we don't know if you have other insurance. So we want to make sure you understand how important it is in the very beginning of your plan year, or now if you need to. You can go to the member account, and it allows you to find to coordinate coverage if that is applicable to your family, or share with us that you do not have any type of existing coordinated benefits between you and your family. This is going to apply when you have like 2 members in a household, both let's say the subscriber and spouse both carry insurance. We need to make sure we know that so that the order of the coverage that your spouse has is properly paid out. So this avoids duplicate payments. It helps to establish which plan is primary and secondary, and also helps to reduce any premiums and out-of-pocket costs you may have. So you can tap into that at any time. You can do it again on the member account on your laptop or computer or through the app. And this is our final slide today. So here's what you can do now to best use your plan benefits in 2026. One, and I cannot stress it enough, download the app. I just love having the information right at my fingertips. New members, again, you will not have the app until after your plan effective date. Register. Sometimes we download the app, but we need to go the next step and we need to register. So go ahead and register so that you can have full access to all of the member account and additional programs we talked about. And then last but not least, just a reminder, your coverage effective date is 1/1/2026. If you're a PPO member, check out the Find Care tool to make sure your doctor is in network if you're making any changes. And for HMO members, please make sure you select a primary care physician for your plan year. With that, thank you so much for your time, and just know at Blue Cross, we are ready to help. I'll be passing it back, I believe, to Deborah.
Okay, thank you, Sharice. We have a few questions in the chat. For those who had questions about HSAs and FSAs, for the HSA, Health Equity will be doing a virtual presentation tomorrow at 12 noon to 12:30. For those who have questions about the FSAs, please give your benefit specialist a call and they can answer your questions directly. And let's see. Okay, so Kim wants to know, will Blue Cross ever offer autism services through the PPO plan? In the past, it has only been through the HMO plan.
The offerings that you have as a benefit on your PPO plan are established in the guides that are available through the county. However, it is an option. It's just a matter of how the coverages are aligned. I can look at those options and provide those back to the county for them to respond more directly. But again, the offerings that are provided to Wayne County employees are provided to you through your benefit documents.
Okay. Let's see. Cassandra had a question about pricing for our Oracle website. Yes, that information will be in Oracle as well as on our benefits website. Lots of questions about HSAs and FSAs. Okay, Joanne wants to know, what services does the co-insurance pay for, and what is the name of the co-insurance plan that is covered? Not sure.
All of the plans have a co-insurance of 20%. All services after deductible typically will have that 20% co-insurance. So it's not just based on the services after it's more so after your deductible is met. If there are services that do not apply deductible, those are usually your fixed dollar copays, as we probably read through it just through a general plan option. So my recommendation, if you're an existing member, to go to our app or go online and you can see what your coverages are. And if you're not an existing member, then you can find out that information in the documents and the brochures that are available through the county that will share what the individual costs are for depending on the service you're having. If you have any additional questions, of course, as an existing member, you can call customer service and they will walk through that with you as well.
Okay, thank you. Also, the plan documents will also be loaded onto our website as well. Susan, I'm sorry, wants to know, what is the reimbursement process when delay in Blue Cross Blue Shield approval of a fee, where we have paid in excess out of pocket, maximum out of pocket, due to a Blue Cross Blue Shield delay in approval of earlier medical expense?
I don't know if you're allowing employees to come off mute to
Yeah, they can come off mute.
maybe
Yeah, Suzanne,
explain. I probably can get a
Suzanne, if you
little more.
want to, if you're still here and you want to come off mute, feel free to, and that way Sharice can better answer your question. I don't know that she's still with us.
Hi, can you hear me?
Yes.
Yes, I
Okay,
can hear
so one of my family members had a $10,000 denied medical lab fee that was then approved back in May, which would have taken us above the maximums for copays and out of pocket and then individual and so forth. So we were paying additional fees at for appointments and labs and things like that for because we hadn't reached the maximums yet. When had that been approved previously, we would have reached it. So now we've exceeded the out-of-pocket max. So how do we have to go to each individual provider and seek reimbursement?
No, great question, Susan. So my recommendation is that you tap into your benefits team. That will require us to do a more of an investigation and reprocessing of your claim. So instead of having you go to each individual doctor to try to get them to resubmit claims, we can do an analysis to determine when you reach that out-of-pocket maximum and then reprocess claims accordingly. So you can either call customer service and they can start that process for you, or you can tap into your benefits team, and if they send that inquiry over to me directly, I can support the question.
Okay, thank you.
You're welcome.
Okay, that looks like that's all the questions we have for our Blue Cross Blue Shield BCN rep. Thank you so much, Cherise. We will now move on to our dental with Alan from Delta.